Thank you. My name is Beth Huertas. I am the project PBIS manager over at Public Health Management Corporation. I'll kind of be like that talk show host guiding my two friends over here. We have a representative from the Stars program, Ms. Cynthia Richards. She is transitioning into her new role as a PBIS coach. And then Ms. Amanda Kozer, right? Yes. Okay, I always miss the spell it and everything. Mandy. And she works with my partner over at Kinder Academy. PHMC, Public Health Management Corporation, and Kinder Academy out in Philadelphia are working with another partner over at CHOP. And so we have a special grant that we are working on. I'll tell you a little bit more about that. But first, let's go over this one. The dynamic duo of Stars and PBIS. It's two programs that we're kind of working within our sites of early childhood education. STARS program has really changed and evolved, as well as the PBIS, and we thought this presentation might be a great way to blend it all together for you. So I appreciate you all attending, and here we go. So a little bit of introductions. My name is Beth Huertas. I came about with this program because I used to be a STARS specialist over in Philly, and we got to partner with CHOP, the Children's Hospital of Philadelphia, because they believe that with the approach of PBIS, that it will reduce the suspension and expulsion rate in early childhood education. They also wanted to gather data on how PBIS is really implemented in our world of early childhood education. What are some of the challenges? How can we tackle that? So when I came on board, we recruited Kinder Academy to be a part of this study to really see how it looks like in our world. And with that, that's been about 2 years now. We're in our second year of implementation. And we've now expanded to other sites in Philly, and that's why Miss Cynthia is now coming on board. And we are working for another 2 years to see some challenges within more sites in Philadelphia. Ms. Cynthia, would you like to share just a little bit about your background?
Good afternoon, everyone. My name is Cynthia Richards. I spent the bulk of my career working in child welfare, working with teens aging out of the foster care system in Philadelphia and New Jersey. And then I found my way back to early childhood as an early childhood education director, and then a Keystone Stars specialist, and then quality coach because our titles changed. And now I am in the world of PBIS as a PBIS coach.
Hi, everyone. So I'm the program coordinator at Kinder Academy, and we have 5 locations in Northeast Philadelphia area, and all the sites are now in somewhat of a process of implementing PBIS. So I'm learning as I go along with Beth as she's coaching me along. We have been involved in STARS for forever, since STARS has been around, so we're just trying to figure out how all the pieces with PBIS mesh into the things that we are already doing at our program. So that's what I'm going to talk about a little later. That's that.
So out in the audience, because we didn't really know who was going to be here today, how many of you are STAR programs, by just raise of the hand? Awesome. How many of you are teachers? Okay. Administration? Perfect. And then support staff, regional people, technical assistants? Gotcha. Trying to get everybody in here. How many of you are first year implementation process of PBIS? A couple. 2 or more years? Oh, we got some veterans. Well, we'll be calling on all of you too. Don't you worry. And then sites that are doing both PBIS and STARS. Okay, a good handful of you. We got some double hands too, which is always good. I love the MO Happy Dance. I do it often. All right, so to help us kind of gear this kind of conversation a little bit more, we're going to talk about what do we already know about STARS and PBIS. With STARS, for some of you that don't know, it is a statewide program. It was voluntary, but now it is, everyone's involved. It's at your level of comfort for your involvement. You can be a level 1, star level 1, which is your DHS certificate of compliance. You can go and ask for a quality coach, or you can kind of just lay low and do your thing. You can also then be star level 2 through 4, and you can engage with the STARS program as much as you would like, meaning you can interact with a quality coach, someone that comes out, interacts with you to help you become higher quality. We provide trainings. We also provide assistance, such as technical assistance, and some resources for you to do that. All right. And then PBIS, that is something many sites are looking to implement, and at different ranges. Some of us are still just exploring what PBIS is, and then some are at full implementation. I see some very familiar faces that have been doing that for many years. So first, I'm going to ask you for your information about STARS. What kind of information do you already know about our program of STARS? And the crickets happen, right? There's no wrong answer. I can spin it any which way. Yes, my friend back there. I'm going to run the mic. I'll go back. Excuse me.
I know that in STARS, if you're working with PBIS and you've established fidelity, you earn points. You're eligible for points, and you can use those points towards maybe if you have like a lower score than what you want, and they can help you increase your score.
Perfect. You just nailed a lot of answers right there. So PBIS is a part of our bonus points now, and it is, you have to be at fidelity to receive those. It's 2 bonus points. And with STARS, back in the day, you have to meet all these standards. Now, you have to do the point system at star 2 through 4. At star 1, there's no points. You just have your DHS certificate of compliance. Star 2, you have to meet those standards. 3 and 4, you're doing those points. And if you need a little boost in a certain area, and if you are at fidelity with PBIS, you get 2 points. Anything else do we know about STARS? Miss Sue.
Well, we were very excited when coaching and shared leadership were built into the STARS system at the upper tiers because they're also part of PBIS.
Definitely, the coaching piece. You can receive a quality coach that can help out with some of that, especially on that STARS end, working with performance standards. And then you can also receive technical assistance that can help teaching staff as well as the leadership part of your program. I saw your hand up. Do you mind passing that down?
I was just going to say that the tools that they use now are the ECHRS 3, which is more of a sort of a social emotional base than the old ECHRS are.
Thank you. So the room assessment piece, everyone talked about the environmental rating scale with the STARS program. That is something that does come out at star 3 and 4, and you can get a little bit more of a boost in scoring, especially if you are with PBIS and implementing those interactions that are positive, those responsive language tools, lots of visuals that really do help with the scoring process with the environmental rating scale or the other room assessment of class, especially at that. They have a new section coming out as the ITERS and ECHRS 3 that can really help with those targeting numbers. Is there anything else? You're like, no, that's why I came to this session. I want to know what you're doing, right? The one thing I will say is with STARS, they do change the indicators or what we call the worksheets yearly. They update them with the feedback or processes throughout that fiscal year. So July 1st is usually, that's the marker that everybody loves because all the worksheets come out and we get to look at them in a little bit of different view sometimes. Now, how about we flip the coin and talk about PBIS? What do we know about PBIS? My friend in the back.
It uses the teapot and tippy toes, which STARS does not accept as a classroom tool.
Oh, I love that. Go for it, right? Yeah. So the question was, statement was, PBIS uses teapot and tippy toes as those assessment pieces, but STARS doesn't look at that piece for credit towards the worksheet. And I'll be honest, I was a little upset about that too, because I really love the teapot and tippy toe. But I will say, and Miss Cynthia, you can back me up, is that we really do want you to use those tools, not just to implement PBIS, but it gives you great data for a self-assessment. And that self-assessment can help you generate goals in your continuous quality improvement process. We always say self-assessment, self-reflection is always great, especially in the STARS process. What are some other items of PBIS that you know of? Yes.
I don't know that I need this, but I know this is my second year attending, and we're kind of in the middle in our center. But not only is it great for the kids, but it gives a school-wide line. Like, this is where we're all at. We're all going to use the same terms. We're all going to, so it unifies us on top of helping the kids. It helps unify us as a team to do better for the kids.
That team spirit comes through with PBIS, that community feel as well. And on the STARS end, we want to see that too, because we know one person can kind of sink a ship. So we want to make sure that we can kind of work together as a team. So PBIS is a part of there too. Yes? She's like, you're coming back with the microphone again, aren't you? Excuse me.
I know that by implementing the methods of PBIS, it can help with us not being people that are guilty of that suspension and expulsion, because by applying the methods, it can help with redirecting behavior. It can also help with helping staff develop methods to cope with challenging behaviors.
And that's what the study we're looking to do as well. The suspension and expulsion piece is a part of STARS, and that was a new thing that was added. So when you're implementing PBIS, even getting a real definition of what a suspension is and what a challenging behavior is, for a lot of sites, that's just coming to light right now. With one of the worksheets indicators, they're asking for a suspension and expulsion policy. That's going to earn some points along the way. So your work with PBIS and how you're looking at challenging behaviors, how you're documenting, how you're trying to put in strategies will be helping in that process of writing that policy. All right, so let's kind of continue, because I am trying to be respectful of time. We do have STARS lingo and PBIS lingo. I tried to put as much of it down there as possible. For STARS, we now are not just in the regional key. We work under early learning resource centers, and those are within your county, and those are within across the state. We do go on the PAQ website. They've revamped it. They made it really easy to use. There's quality coaches, or what we call QCs. We also have early childhood mental health consultants that can come out. That can help with those challenging behaviors to guide you in the practices. Technical assistants, like I mentioned before, that can go in and work with teachers on lesson planning, classroom management. Some room assessments that were mentioned, the environmental rating scales, the ERS, the ITERS is infant toddlers. The ECHRS is the preschool level. School age has the SACRs. We also use class now. ERS and class are the two that you can get points for and for a certain score. For PBIS, the side of program-wide, PW, benchmarks for quality. Those are your guiding forces on how to implement PBIS. Your CLT, core leadership teams. Your CEFL, Center on the Social Emotional Foundation of Early Learning. Your tippy-toe and teapot for both. Teapot is for preschool, tippy-toe is for infant toddler. Your observation tools. Preset, the tool to use for understanding the fidelity of PBIS in an early childhood setting. And then the PTRYC, the Prevent, Teach, Reinforce Young Children team, based off those individual at the higher tier. And I know I've been learning quite a bit about that through a lot of webinars coming out as well. But those are some things that you might be hearing along the way. So we're going to go, and I'm going to bounce to Cynthia and Miss Amanda to talk about the similarities between STARS and PBIS. For one thing, there's a lot of information on the internet, right? The PA key is a great source for STARS information. And of course, it's not going to load for me. But that's on the internet. You can get all your STARS information. And then also through our PBIS website is always a great one, as well as the national level as well. So the first one we're going to talk about is the guiding force that we found that was very similar between PBIS and STARS was a continuous quality improvement plan. We use self-assessments as well as data collection to feed that information to form for sites. So I'm going to ask Miss Cynthia to share what that looks like on the STARS end, and then Miss Mandy's going to share what that looks like for a site that's trying to implement PBIS and STARS.
So for those of you in the room who have used the ERS scales to do self-assessment, you know that your quality coach is looking for you. If you are at STAR 2 level, you are to be using the ERS, because I don't know, there's not a self-assessment to use for class, but the ERS scales allows you to self-assess, go into each of the classrooms. The quality coach is looking for you to have a self-assessment done for each of the classrooms. And so if it's an infant and or toddler classroom, your ITERS, ECHRS for preschool, and SACRS for school age. And you use that to be reflective, to look at what's going on in the classroom environment. And then from that, that's like a starting point to develop the continuous quality improvement plan, identifying what is it that I want to work on? What did I find that needs to be improved? And popping that onto the CQI plan, along with discussing it with teaching staff, hoping to get some reflection and some buy-in by the teachers, and then helping to develop a plan so that we can start to pick apart what are the things that we're going to focus on for the year. And then PASS or BAS, the Program Administration Scale or Business Administration Scale. So the PASS is used for group and center-based programs. The Business Administration Scale is used for family child care providers. And those self-assessments actually show up in 3 separate places in the Keystone Stars Performance Standards and count for points in 2 places. So it can be used as a self-assessment to go beyond. So for programs who have used the ERS scales repeatedly and are actively using them and very familiar, they may want an overall look, holistic look at their program from a business standpoint. What's going on in my entire program, not just classroom specific. And then that it can be used as the self-assessment. It also shows up in the early care and education section for points. And then again, in leadership and management, it's called out by name for additional points. So programs who are very familiar with self-assessing and are ready to take it to another level, quality coaches are going to be encouraging them to consider doing a more whole program self-assessment.
So I'm basically just going to speak about what my role is and what my experiences have been at Kinder Academy. Like I had mentioned earlier, we've been STARS facilities, so we're always doing ERS assessments year after year, and my role is to go in and do an assessment and then support the teachers to, create better environments, action plans, and whatnot. So what I was really trying to do this year was show the teachers that we're doing ERS already, but how it links to PBIS and how it links to the pyramid and the inventory, and how things that we do on a regular is PBIS. So something as simple on an ERS scale as having toys at the level that's preventing behaviors in the classroom. So that's been like a huge part of how I'm just trying to show the teachers that PBIS and STARS, they align perfectly together, and it's not something separate that we're doing in our classrooms, but showing them the connections. Because I remember back in the day when I was a young teacher, all these initiatives were coming along, and it was like, we got to do this, we're doing that, we got ERS, we got STARS, and it's like, what is all this stuff? So I really tried to help the teachers see the connection amongst everything, because I remember that moment when somebody showed that to me, and I was like, yes, like we have to be better at that with our teachers, so they're not feeling completely overwhelmed by all of these things that we're doing in the classrooms. So that's really just a big part. So I don't know if anyone has questions about how we are linking the two, but that's what I said. I'm just here to kind of offer my in-house support as I go through this experience with PBIS. So that's what I got.
Has anybody had the experience of having like a self-assessment come out, done, and then having like the actual assessment of ERS or class come in to help kind of give you some more data on that development of your site goals? Or working with a quality coach to kind of develop any kind of goals for your site? Not yet. I would say, to be honest, there has been a lot of changes with the STARS program and helping, kind of work you through this process. So I would recommend you calling or emailing your quality coach at the STARS program and asking to say, can we sit down? Can we talk about what I'm already doing to implement high quality at my site? I'm working as a PBIS implementator to be the best I can be, but I don't want to do double the amount of work, because sometimes that's how it feels, right? Especially when we come in as a coach and, sometimes teachers need that extra person to say, well, you need to get down on the child's level, and it helps with the interaction because they can see you, they can hear you, you can interact and move that lesson along a little bit more. That outside person really does help on occasion. Yes?
I do have to say, we did the PAS.
I'm so sorry.
Sorry.
Do you mind passing?
I was just saying that we did do I don't know, is it PAS? Is that how you, and it did help with a lot of different aspects of our center. Like there was little things that were like a parent social, which was like something, is very PBIS, but we never really even thought about it, but it came up in that, by doing that, which you wouldn't expect. It's more like business, you would think, looking at that, but there was something very social, very PBIS that was within there. There's a couple of things actually, but that was just one thing that stood out. Yeah.
Perfect. Thank you for sharing. A lot of things that we're doing it's what we would do naturally in our field of just getting people together, doing what we're doing with implementation of PBIS, but it will help in the STARS aspect as well. Yes.
Question.
Okay. So we are service coordinators for the Lancaster-Lebanon IU13 Early Intervention Preschool Program, and we provide services for children that are out in STARS programs. And we work with some of those programs that are using PBIS, but my question is, how are these STARS programs finding out about PBIS? Is it something that's recommended to them? Do they kind of find out about it on their own? Because we're in the process of kind of asking a lot of the preschools and daycares that we work with, like, what are you using for behavior? Because that's a lot of referrals that we get to evaluate our children who are having behavior problems in those settings.
Great question. So with PBIS, I found out about it because I worked at Lancaster Head Start CAP, Community Action Program, and that's how I brought it into where I was when I moved to Philly. We found, and please quote me if I'm wrong, Miss Julia, Miss Cynthia, a lot of people are finding out about PBIS through the STARS worksheet because of the bonus points. They were like, well, what's that? And they're starting to ask quality coaches. They're also finding out through our early childhood mental health consultants as well. We do a lot of CEPHL trainings. Miss Tanisha is our PD person over at the STARS program in Philly. So they're finding out quite a bit about the process through some professional development opportunities. Yes.
It's also in your CDA now too.
Oh, I did not know that. Thank you for that information. It's actually now in our CDA programs. When teachers are going in to get that certificate, they are finding it out. Wonderful. With continuous quality improvement plans, it affects your entire building. PBIS is your entire building as well as STARS. So your continuous quality improvement plan can be focusing on one group or one process depending on what your goal is for your site. All right. Oh, I'm sorry, I didn't see your hand.
We found out about PBIS through a grant that our early intervention agency in our county got, and then they included us in the grant, so we were able to get some funding.
So our friend in the back was mentioning that she found out about PBIS through a grant that was in their area, and then they got recruited, it sounds like, from that grant to implement that PBIS at their agency. That's also how Kinder Academy kind of came a little bit more involved with the PBIS work. Yes. I thank you for all these comments and questions. It goes a little bit faster with the...
I'm going to save you some steps. We found out about PBIS originally from a special ed teacher that was providing services in our program in 2009. And also during that time, sometime after that, there was a special training that was free that was introducing the PATH social curriculum that was in, I think it was in Berks County somewhere. And then fast forwarding to now, so let me go back a little bit. So then, we would implement the different things, the different skills and the social stories with the children. It was targeted for 2, but we just used it for everyone. Then when in our area, they got a grant and several years back and included us in as far as implementing it. But we didn't realize that we sort of like were sitting on a gold mine because of having the curriculum and then having the exposure. So that's how we connected with it. So as a result, when we develop our CQIs, we always consider what may be needed as far as some of the PBIS needs.
Thank you for sharing your story. So lots of times the CQI plan starts to evolve for you, and you're finding out different programs that you can implement, different grants that might be coming around, different resources within your community. And STARS can be that person that kind of tells you, as well as facilitate some of those network meetings that can happen. The next section we found that was very similar between STARS and PBIS was the staff buy-in. Ms. Cynthia, can you tell how the importance of that in the STARS program, the staff buy-in?
Sure. One of the things that I noticed about the new performance standards is that all staff everyone on a team at a location is required to take STARS 101 and 102, where previously that was not the case. Only directors had to take the training. And so I'll get questions oftentimes about why do we have to take these trainings? And so, they don't really understand why it's, really important for them to know what the STAR system is about. What are the performance standards about? Why, what are the connections between what needs to happen in leadership and management and, or the early care and education program, or how to create a CQI plan and all of the different supports and resources that are in place. But previously, that was just the load that the director carried. And so now, whether there's, full understanding or not, introducing them into that, kind of higher order understanding is really important. And then you can expect folks to step up to the plate and to start to, take on, more leadership roles and be supportive of one another. That about it? Did you want Mandy? No?
They're like, I'm all done. Staff buy-in is good, right? Staff buy-in is usually the biggest problem that we encounter, right? I call it, it's not a problem, it's a hiccup, it's a roadblock. And I said earlier, it takes one person to kind of like sink your ship. That one negative Nancy or Ned, it kind of gravitates, right? And they get that pull going. With STARS, it is something that some people are like, look, I've been in early childhood education. I don't need something else. I don't need someone else telling me what to do. I got this. PBIS is the same way, right? You need that buy-in. They need to have that one kid that gives them that like ruffle under their feathers and they just can't like figure them out to kind of buy into the process. We can give a lot of information and resources, but until that person kind of figures out this is a program that works for them, this is an approach that works, this is a reason why we need to do what we do, it takes a while. Sometimes I wish I was like, look, I'm passionate, let's just go full force. Not everyone's like that, right? Some teachers, brand new right out of college, this is how teaching is supposed to be. And we're doing that culture shift, both in PBIS and in STARS. For some of it in STARS, it's like that basic, kids can't walk in the hallway by themselves. Yeah, it still happens. It's supervision. In PBIS, talking to children is awesome. Do you know how many classrooms we walk in and it's just silent? And you're like, how do you not talk to a baby? Just say something kind. Say hello. That buy-in is hard. So what do you all do for buy-in for your staff, both in just getting them into going to work and wanting to be there? Oh, yep. Hand went right up. Thank you.
We were just talking about this at a training I attended Friday, and we mentioned that using those negative Nellies to be part of that core team for PBIS. Like, we found out that having those people that are the negative and that can kill the whole group, we're better off to be on your team to get that buy-in and make the buy-in, like have some of the strategies and techniques to use in the PBIS was the way to go, and that helped out a little bit.
I have a question for you.
Yeah, sure.
Get them on the team.
Yeah, so we did start off by asking, staff to volunteer. And, you could, if you were looking at certain like age groups, or you could say, I need someone in this area, and then someone would have to at that point. So then it left it up to those two to decide, well, who wants to do that? And those two could have been the negative too, but one of them was going, so it was almost like you were getting your way either way with that. By having those two have to choose amongst themselves, you were still getting one of them to be a part of that team. And we didn't make anyone do that, but you sure did get a part of those people that are hard to get the buy-in on that group, which made it better for us.
I also kind of did that. I went for the negative Nancy, and I just said, I really want to hear what you have to say. And then it was just like, you want me, I'll tell you what you want to hear. And I was like, sure. No, I don't want to hear what I want to hear. I want to know what you feel. And that's going to make a difference, because that's going to help us figure out how to make this work in our program. Both, I'll do it, honestly, I did it for STARS as well as PBIS.
I kind of have a question, and maybe someone in the room can answer it. We have a very big split, I would say, in our school of old school, as we call it, and new school. Me being obviously on the newer end, coming, fresh and young. We have the teachers that are old and set in their ways. I mean, even getting them to buy into Stars was rough. They were like, well, why do we need this? And I was like, well, listen, I'll give you the mom perspective. I'm not going to send my kid to an unstarred school. Just not going to do it. I look at the Stars when I walk into that building. People are going to look at it and they're like, well, they don't care. So now we're having that with PBIS too. They're like, well, nobody cares about it. There are parents that care.
So who has the answer for that? Okay.
And it's not going to sound very good. No, but sometimes it's easier to blame somebody else or sorry, but we blame Stars. But sometimes teachers need to say sorry, we know, but this is what they're requiring of us, So once they start doing it and then they realize, because I had to do a talk on staff buy-in at one point for PBIS, and I went around and asked all the people who were originally in there, and I said, what'd you think when I came and brought this to you guys? And they're like, we thought it was a load. We didn't think it was going to last. We just thought it was another thing you were putting on our plate. And we were like, yeah, it'll go away soon. So when Stars bought into it, it was easier. To be honest, we blamed the IU who we did our person there. So, but now with Stars being involved, it's even easier to blame somebody to say, this is who they're requiring it of us. And Stars gives money. So unfortunately, there is a motivator of money. We don't get it anymore, but our teachers still get the ERA. So, money motivates, unfortunately, but it does work.
Thank you for sharing. Yes, it's those little motivators. Sometimes it is. I've gotten blamed for everything, DHS, Stars, and stuff like that. Where's my friend over here? And sometimes it's also just to say, we want the best for our children. This is what we're going to do. Staff surveys are another great one. I love reading the responses of staff surveys. When you leave a blank, you get some really good things happening there.
So I'm actually a nationally certified school psychologist, and I work pre-K through 12 in the state of Pennsylvania. And so I do provide support to some of our early intervention friends. And as a school psychologist, we frequently feel like used car salesmen, like, try this, because with interventions and such, you do get the people who are very old school or, oh my gosh, it's never going to work, even though I have tons of evidence-based instructional strategies and interventions in my back pocket. And I will always tell staff, you know what? I know this idea sounds super duper crazy, but just try it for 2 weeks. Even if it doesn't work for 2 weeks, you can always go back to dealing with that bad behavior on your own. And usually they'll try it for 2 weeks and something will work within that 2 week time period. It may not be exactly as I had. And I will go into the classrooms and I will model interventions and I will model different strategies, because a lot of times it's just people don't know. And just like a child, even with some adults, you have to directly and explicitly teach how to do things. So I will go into classrooms and model the intervention or, the different, the tiers, and then just provide the support. But then I always just tell them, hey, after it doesn't work for 2 weeks, I don't need to come in here ever again. And usually it doesn't happen because they typically always come back for something more. But so just kind of putting that on them and just giving it a try. So you will sound like a used car salesman, but it does tend to work.
Thank you so much. And sometimes it's just breaking it down, just saying, try it for 2 weeks, do this one thing. That's all I'm asking you to do. And then see if you can build on that until that buy-in slowly gets there. Last question.
We actually incorporated it into our program policy and into job descriptions. So during interviews, it comes up, what's this positive behavior intervention supports? And then we talk about it at that time. So, and then what's a high quality program? Well, that's Stars. And we participate in that. And these are the things we have to do in order to be continued to be a Star 4 level. And with the old school and the new school, some of the old school got off the train. They didn't want to come along, so they're no longer with us.
Thank you. And just putting it into policies and procedures, that was a great way. STARS asks for that high quality thinking. Job descriptions, sites don't always change those as time evolves. That's a big piece of what PBIS does, because we're handling classroom management differently. Our language is different. That's going to be a great link.
I know at our center personally that just pointing out what we were already doing that was PBIS, even though it might not have been called PBIS, people were like, oh yeah, I already do that. So it not necessarily wasn't something new for them, but they thought that it was. So it was like, oh, one more thing, or oh, something new. No, it's not new. It's just a name for what you're already doing. So
Thank you. That's a great too. It is. That's why it's so important to contact your quality coach for your STARS questions, because you're doing a lot of this already. Same thing with PBIS. I'm always hitting up Julia going, I'm doing it this way. How does that kind of relate? And we can make it work.
Must have been reading my mind. And that's one of the things that I think I got really excited about with the new STARS, because the new performance standards gets away from, or hopes to get away from, that kind of cookie cutter, these are the things that you need to do. And so it forces quality coaches and people who are working in that system to try to figure out, how can meeting this performance standard look this way in this program and look different in another program? And I'll always talk to my providers about, tell me what you're already doing. And that, we know positive reinforcement, it works not only with kids, but it works with adults too. So validating that you are already doing some dynamite things. Let's talk about all the things that are working really well. And then, setting those goals. So it is, the blend is very exciting.
All right, we're going to move on just to keep in the time requirement. The next one we found that was very similar was professional development plans. Yes, the STARS piece is online, but they have those teaching competencies. In the worksheets, there are some areas where you can get points for social emotional training, curriculum training, strengthening families, inclusion, positive interactions, the developmental screening tools. Those are all things that in PBIS world that we're looking to seek out for the data, right? And that knowledge base. I'm going to throw this one to Miss Mandy, because she at Kinder Academy has really worked hard on the professional development aspect.
Yes. So we are fortunate that when we got into PBIS, it was when all the things were changing with STARS. So we had more flexibility with trainings and who could offer training. It didn't have to be somebody with PQAS. Sorry for PQAS people out there, but you know what I'm saying. So I could actually go in and do some trainings for the staff, and they would actually get credit for it and recognized. So this has been a great opportunity for us with our curriculum and linking PBIS to our teaching materials and the curriculum that we're using. We're also doing something to introduce PBIS to new staff coming in, but also people who've been in, called our PBIS Passport. And it's a system, so we know everybody's receiving the same information and going through the systems to learn what the practices will be. So for example, we have bucket filling that we're using at Kinder Academy. So in the Passport, there's procedures on what that looks like in our classroom, how the teachers can implement that. It gives them opportunity to reflect on what they're currently doing in the classroom. And once they finish that section, we kind of sign and date it. It's great, we got through that area. So that is something new that we're doing that we're really excited about. Beth is our coach at Kinder Academy, so she's supporting us along the way as we're figuring these things out. And it's not just me as the program coordinator or Beth doing it. Our administrators, which I have one in the house, Colleen, she will be helping implement PBIS through this Passport as well. So it's not just one or two people, but everybody's getting on board, introducing the material, and it's all consistent information across the board. So, anything else you want me to say about Passport?
With the Passport, there is that coaching piece, that there's follow-up with it. So we are going into observe answer questions, modeling, or giving some more feedback. They are also at Kinder Academy revamping their new staff orientation. So yes, they're going over their policies and procedures and their job descriptions, but then also going in and highlighting curriculum parts, as well as some of the STARS requirements that to keep their STAR level, all of their staff needs to complete. So STARS 101 and 102. They also are doing the environmental rating scales for their assessment. So they want to make sure their teachers are trained in that. So they put that all in their new staff orientation. Whatever they were looking to keep their points in, that's where they're putting their new staff orientation training hours. They're also doing a lot of shadowing and modeling in their classrooms, from those veteran teachers that have it down to new staff that are bringing some really great ideas that they want to highlight as well. So they really took a look at their professional development and said, okay, we can just kind of do the train and hope kind of series, or we can really make this work. And I think over the past couple of months, we've seen a great deal of the aha moments happening in the classroom more. I saw a hand up.
What is the passport? Is it like a program or is it paper or?
It is. It's actually in a binder, and there's a little color-coded system in the front, and it goes through each of the practices that we want the teachers to learn about when they first come on board. So it's one section is the inventory of practices. So we'll go through that and explain to the teachers, this is the assessment that you'll use on yourself to assess your practices for the inventory, the pyramid. The other section has, like I had said, a bucket filler section, our program-wide expectations section. We have something in our classroom called a safe space, so like what the expectation is for that. So they go through all these practices that we want to see across all of our classrooms and learn, like, this is how we do it, this is what it looks like, and it gives opportunity again for them to kind of reflect upon things that they've seen. Because what we also have the teachers do is go and visit classrooms that are instituting those practices and see what it looks like. So they can write notes about that if they have questions or if they need further training on it. But it's just a nice system because we have all these great ideas when we first started PBIS, and we're like, well, how do we know everybody's getting the same information and it's consistent? So this was what we came up with for this year. So like I said, this is our second year in, so we're learning a lot as we go, but it's been a great journey. Thank you. Thank you.
All right, I know we're getting close to that time. I want to just hit a little bit about the family involvement because both PBIS has that as well as the STARS requirement. So I'm going to throw that to Ms. Cynthia first.
So there is one of the 4 sections in the STARS performance standards talks about partnerships with families and communities. And one of the actual self-assessment tools that programs can use as they try to move towards STAR 3 and 4 is the Strengthening Families Protective Factors framework as a self-assessment that they would complete. One of the leadership team or administrator would usually complete the self-assessment and then identify, they have to do the training. So the training is offered online and in person. They would complete the self-assessment and then develop CQI goals. And from providers that I've talked to who have used it, they absolutely love the Strengthening Families tool. It forces them to look at things that they just kind of never really think about. A lot of times we're like little robots and we do whatever STARS tells us to do. And then when you look at the why behind the what, it starts to connect and makes a lot of sense. And they are excited about it because they're doing some really good things connecting with families and understanding how families operate.
With the family aspect on that in the site, we're working on trying to get more families involved with understanding what PBIS is, but then also helping with the decision-making process, joining the core leadership team, attending events. Different languages is always a barrier, so we're working on some ideas to develop that, but we want to make sure that everyone is included. So trying to translate as much as possible, asking for input. They do a parent survey as well. Whoops. The next one just to hit on is some policy and procedures that are very similar in the both programs, suspension and expulsion policy, how you're handling challenging behaviors, defining it. I think we've talked a little bit about it. Classroom transitions, sharing that, kids are moving up into a different classroom, who their teachers are going to be. That's building those relationships. It's making the parents feel a part of the decision, having a meeting with that, talking about their child and what their needs are, and then the expectations on how that looks like at each age level. With the STARS, the planning and curriculum time is always an option too for some points. As you know, as you're implementing PBIS, curriculum and just planning and getting, time to really reflect on what's going on in your classroom, going over data, you have to separate some time out. So that's going to take you into that admin role of, do we have substitutes that can pop into a classroom to do that? Not many of us have that. So how are we going to work that out in our budget? What does that look like? Do I have to train teachers to understand how to read data and understand, maybe going to some trainings? So really budgeting for that. Your challenging behaviors process, you're going through that with the PBIS implementations and your benchmarks for quality, but it's also going to help you in that STARS piece, because you're going to have teachers that will always say, if that kid just leaves, it's going to be an easier classroom. And really, now you're just asking for an expulsion. So having those decision trees, if this happens in your classroom, try this strategy to support both programs. And then the behavior incident reports, tracking that data as well. For room assessments, we've talked a little bit about that. The inventory of practice on the PBIS side is a great tool to increase the level of quality within your site, as well as doing those self-assessments in the ERS in class. The teapot and tippy toe, I highly recommend you doing that as well, because you're going to see those scores in the ECHRs and the ITRs and the ECHRs and the class be boosted up with that. And then reaching fidelity. Fidelity here is getting that wonderful banner, right? After that preset and coming in, you're like, yes, I loved all that recognition you're seeing at lunch. For the STARS aspect, we call it designation. You're going to have a designator come out to review all of your, points that you're looking to obtain. They're going to go over that data for you. They're going to help you write a CQI if you need an area to improve as well. And then you get your STAR level according to where you fit on your worksheet. So some resources. The PAQ website is amazing. It's definitely gotten revamped. It's helped out quite a bit. I would say go definitely there. It will contact you with your Early Learning Resource Center as well as your quality coach, your professional development registry for training needs. Also to find a PQAS instructor if you're looking for that. PATAN, that's always a great website, which got revamped, as well as the CEPHL, and then the National Center for Pyramid Model Interventions. Talk to your quality coach on the STARS side, and then talk to your PBIS network. I know for me, it's Miss Julia, and she's been amazing to help me on this journey as a teacher, now as a facilitator. And she has a plethora of knowledge on the PBIS side, and your quality coach for STARS will have that on the STARS side. I just thank you so much for your time. Is there any questions that we could answer? You're like, no, just give me the secret word, right?
I do have the sample passport if anyone just wants to kind of look at it.
Yes. And then my email's here. It's bwertas@phmc. If you do have any questions, feel free to email me. I'll get you as much information back to you as possible. But thank you for your time.
Thank you so much for your active participation in this session today. I think because there's so much newness, I think let's continue the conversation, because this really is critical for not only our staff, but the children and families.